Welcome to Old Main. A walk down these historic halls provides a unique experience, an exploration into the evolution of mental health care in New York State, how it started, how far treatment has evolved, and what that history means to the future of mental health. Aside from that relevance, your visit enables you to experience firsthand one of the finest examples of Greek Revival architecture from the mid-19th century. Pride exists in design, as well as in the remarkable work that was accomplished at Old Main for nearly a century and a half. Early in the 19th century, the need arose for an institution that specialized in the care of the mentally ill. Families couldn't provide this care on their own, and those individuals who were not being cared for by family members were sent to poorhouses, where the conditions were appalling. Advocates encouraged government to step in, stating it was a social problem that needed state intervention.
The philosophy at that time was to create an environment where somebody could be removed from a very chaotic, a very, in some cases, oppressive or neglected environment. Many of these folks were not being cared for their families, but the notion was to bring them into a place where they could be treated like you want to be treated.
The advocates' efforts were successful, and it was decided to build New York State's first publicly funded institution in Utica. Utica was an ideal location due to the growth in commerce and population, thanks to the Erie Canal. Utica was becoming a major business center and was a central location for all areas within upstate New York. It was important to build a facility that was not only accessible to patients, but to the families of those patients statewide as well. The establishment of the New York State Lunatic Asylum in 1843 made a big impact on the Utica economy.
It's hard for me to think of anything beyond the local manufacturing industries in the area that would have eclipsed this facility as far as employment or contributions to the local economy.
From the start, the New York State Lunatic Asylum, which later became known as the Utica State Hospital, was one of the most progressive facilities in the field of mental health and put Utica on the map as a center of psychiatry. The first superintendent, Dr. Amariah Brigham, published the first American Journal of Insanity at his own expense at the Utica Asylum in 1844. That publication later renamed the American Journal of Psychiatry. This was the first such journal published in the English language. Over the years, enrollment grew exponentially. Expansion projects added wings on both ends of the main building to meet the demand. Newer populations of patients were now receiving assistance, victims of post-war trauma, as well as those who were debilitated with age-related illnesses such as senility. As times changed, so did treatment of the mentally ill.
I think there were some things that some people think might not have been a good idea, but I think mostly were argued to be helped because they were a more humane alternative to mechanical restraints and other kinds of forceful restraints. I'm convinced that the majority of the individuals involved in the institutional care of folks with mental illness had their heart in the right place and were doing it because they really cared for individuals that they saw were far less fortunate than they were.
This facility, when it was built, if you look at it in the context of the early 19th century, was one of the most progressive facilities for the treatment of the mentally ill, not only in New York, but in the United States. And that's the story that I feel is important. People who came here had an opportunity to not just exist, but to recover and possibly thrive as they were treated for their maladies. That's not something that people suffering from mental illness could really expect in the years prior to the establishment of progressive facilities like this one.
Over the years, the advancement of mental health care progressed beyond the walls of Old Main. Newer facilities were built. Patients were transferred. New treatment programs were putting patients inside the community. Care was becoming more personalized. Further growth was achieved with the success of somatic therapies, antipsychotic medication, the decrease in crowding, and the redevelopment and increase of professionally trained staff. On September 28, 1978, The main building of Utica State Hospital was unable to meet safety codes and its doors were closed after 135 years in operation and 7 years after being placed on the National Register of Historic Places. The years passed and Old Main stood vacant, subjected to many years of dormancy. What could be done to make Old Main relevant once again? Old Main has been repurposed as a statewide record storage facility for the Office of Mental Health. Thanks to tremendous restoration efforts, including the removal of asbestos and lead paint, the vast hallways and abundant rooms provide ample amounts of storage space for important documentation, areas of which are off limits to the general public. Restoration efforts were taken a step further with the opening of the museum-like space you are currently standing in. The main portion of the first floor has been painstakingly restored to resemble this facility in its prime, complete with period-perfect furniture and fixtures. For the first time in decades, visitors can see for themselves one of the most historically and architecturally significant structures in Oneida County. There is so much to be proud of. Old Main still stands, though its purpose has changed. Old Main is a reminder of where mental health has been and what has been accomplished in New York State and in the world of psychiatry.
Walk through this facility and think about the people that were housed here. Think about the progressive nature of how they were treated. And think about the influence that Old Main had on the treatment of the mentally ill, which started in the 1840s, but the legacy which was established here still resonates very strongly today.